Assalamu alaikum to my all beloved students. I hope that you are all well. May Allah help us to overcome this situation. We pray to Allah to help us and to protect us from this situation. May Allah bless our country and as well as people of our country. Yesterday, I told some important topics of virginity and defloration. Now today I am going to discuss elaborately rest of the topics importance for say upcoming professional examination. Yesterday I talked about what is virginity, what is defloration, what are the signs of virginity of a young girl, what are signs of defloration, different hymen, types of hymen. Most common type of hymen is annular. Oral questions. A written question define hymen, types of hymen. How do you mean active viris? Important question. What are the difference between true virgin and pseudo virgin? What are the difference between virginity and defloration? What are the causes of pseudo virginity? What do you mean by vaginous mass? Now I go for legitimacy and paternity. Define legitimacy, define paternity. What is illegitimacy? Illegitimacy means, or illegitimate child means bastard child. What is disputed paternity, disputed maternity? Medical legal importance of legitimacy and paternity. How can we establish a paternity of a child? Answer will be parental likeness, atavism, blood grouping, DNA typing. What do you mean by posthumous child? Important for short note. What do you mean by supposititious child or fictitious child? Important question for written. What do you mean by affiliation case? Important question. How can you determine paternity of a child? Again, I tell you, a very very important question. Examples of posthumous child is important for Viva. Define marriage. Define divorce. Medical legal importance of marriage and divorce. Cause of nullity of marriage. Important question. Very much important question in written and oral examination. When a wife can divorce her husband, when a man can divorce his wife, husband can divorce his wife. Now I go for importance and sterility. Defines importance. Define sterility. You made some mistakes in previous second term examination. Importance. Importance means inability of a male to perform sexual intercourse or to achieve sexual gratification. Some of you wrote inability to you wrote sterility definition. It's not true. Importance and sterility, there are different terms. Sterility, inability to beget child in case of male, inability to conceive child in case of female. This is your answer. Importance opposite term হচ্ছে frigidity. Frigidity I have already told you in psychosexual disorder, very much important. You must learn it from psychosexual disorder from your research note. What are importance and sterility of causes of importance and sterility of a male. There are primary cause and secondary cause. You must read two different things. Primary cause. Primary cause means by born. Secondary cause after death. Acquired cause. What are the causes? What are the causes of importance and sterility in case of female? Primary cause, secondary cause. Always causes divided into two types, primary and secondary. Primary, again I repeat, primary means by born inherited properties, and secondary means after birth, acquired cause. What is nymphomania? Female pneumonia in case of male satyriasis. Sometimes ask you in prof examination or in written examination. What is quart hunk? What is bridegroom frigidity? What is vaginous mass? Important question. What is vaginous mass? Now I go for sterilization. Define sterilization. Classify sterilization. Medical legal importance of sterilization. Or the temporary and permanent methods of sterilization in both male and female. Male and female uvoid sterilization of temporary and permanent method. You must learn it from community medicine. And you answer this question or written or from community medicine. What do you mean artificial insemination? Artificial introduction of semen into the vagina, uterus or cervix to bring about pregnancy without any sexual intercourse. Types of artificial insemination. Artificial insemination are three types. Artificial insemination husband, artificial insemination donor, artificial insemination mixed or pooled. Which one is the best? Your answer is husband. Next, pooled. Then donor. AID, and it's a pooled. What are the procedure of artificial insemination? Medical legal importance. Prerequisites of procedure are the same. What are prerequisites of artificial insemination, or what are the procedure of artificial insemination? Both are the same question. Answer will be the same. Complications of artificial insemination. Another important question. Medical legal importance of artificial insemination. Then I go for some important topics. What is vitro fertilization? Vitro means outside fertilization. Vitro means outside. Example is a test tube baby cloning. Vivo fertilization means inside. Artificial insemination. If any question asked in oral examination, prof examination, artificial insemination is artificial insemination practiced in Bangladesh? Your answer is not yet. Which method of artificial pregnancy practiced in Bangladesh? That is test tube baby. You have some foreign students from Kashmir and India. In India, the practice kunta? In India, artificial insemination, test tube baby, and surrogate mother. These are the practice in India, but Bangladesh practice only one thing is test tube baby. What is test tube baby? Short note. What is cloning? Cloning means genetically identical duplicate. Genetically identical. Genetic identical same genetical character. Gene character are the same. Duplicate same. First human born by cloning. Your answer will be if a female baby. First animal of cloning, dolly, a female sheep. Both are not, both are animal and the human baby are dead. Are dead. What is surrogate mother? Surrogate mother. It was practiced mostly in India, Kerala, Uttar Pradesh. Short note, surrogate motherhood. Another important question of fecundation of extra. This question is belongs to importance of sterilization. Surrogate motherhood, cloning, very much important question nowadays. You must learn it. I have told some important questions for general students, for preparatory study, for upcoming second professional examination. You must read it. If anyone don't understand any question, you may ask me, myself, and to our teacher in WhatsApp or an YouTube channel or in lectures. Then I go for repetition. You must study yourself hard and hard because you are staying at home. Be prepared yourself to be well in second professional examination. We wish you all have to pass the second professional examination. Stay safe, stay home, and pray to Allah that we must, we have to overcome this situation. Pray to all the peoples of the world to save us from coronavirus. May Allah bless you. Now I conclude my lectures by 8 parts. Then I go for practical topics. That means OSPE and traditional. From next day I want to tell you some practicals and OSPE topics or traditional topics. Till now, Khuda Hafiz. May Allah bless you.